Quicker than quicksand. Stronger than the body odor in a locker room. Rapid, accurate, essential, and available in rainbow colors. This is Quick Zips, the late night edition. Sexuality education fast.
I'm Galena Mines, and welcome to our show. When people get STIs, they hope to get rid of them. And Galena's got the 411 on treating STIs. So, we'll assume all these people made the first right choice. They went to a doctor. So the question is, how will a doctor or other healthcare provider treat your STI? This is a really good question. If STIs are left untreated, they can cause long-term problems. First, it is important to know that fixing or treating an STI involves three very different things. The best situation is when the doctor can cure the infection. That means getting rid of it entirely so you are no longer infected. In some cases, the doctor can't cure the infection, but can treat it so that you don't get symptoms as often. And when you do not have active sores and drips, you may be less likely to pass the infection to someone else. But it is important to remember that you are still infected. Finally, the doctor can treat the symptoms so that they are less painful and annoying. And, more importantly, so that the infection does less harm to the body. The tricky part is that which of these things a doc does depends on what specific STI you have. Unfortunately, not all of them are curable. Remember, there are three basic types of STIs: bacterial, parasitic, and viral. Bacterial STIs include gonorrhea and chlamydia and are treated and cured with antibiotics if they are caught early. These bacterial STIs can still cause problems if they aren't treated early. The antibiotics might be pills or shots. Usually it takes about a week of antibiotics to be cured of a bacterial STI. But you have to take the medicine exactly as the doctor instructs, or it may not work. And you have to take all of the medicine, even if the symptoms go away and you feel better. And no sexual activity of any kind for at least 7 days after both you and your partner have started treatment, because either of you can still be contagious. That means no sex, no oral sex, no anal sex, not even with a condom. Parasitic STIs like crabs and scabies are treated and cured by prescription shampoos or lotions that you can get from your doctor. It usually takes about 2 weeks to be cured of a parasitic STI. Viral STIs, herpes, HPV, and HIV cannot be cured. Once you have a viral STI like herpes or HIV, you have it for the rest of your life. However, there are treatments for viral STIs that help reduce how often you get symptoms. For example, herpes keeps coming back over and over throughout your life, but medicine can make the return visits less frequent and of shorter duration and not hurt as much. Docs can also reduce the severity of symptoms. For example, HPV causes warts, and you can have the warts removed, but you still have the virus, just not the actual warts anymore. And HIV, which eventually destroys a person's immune system, can be slowed with medications. So, bacterial and parasitic STIs can be treated and cured. Viral STIs can only be treated, not cured. A final word about partners. If you have an STI, your doctor will tell you that your partner needs to be treated too. If your partner isn't treated and cured, and you continue to have sexual contact, you could be reinfected. If you have more than one sex partner, you need to make sure that they all get treated. In the end, there are no over-the-counter medicines you can use. There are no home remedies. The only way to treat an STI is to visit a healthcare provider. That's it for this segment of Quick Zips, the late night edition. Remember, it takes more than duct tape to fix an STI, so see a doctor. Be safe. See you next time.
This episode of Quick Zips is brought to you by Dr. Bob's Sexual Health Service, which would like to remind you to get treated because friends don't give friends STIs.